Thank you so much, David. Well, it's Wednesday, and that means it's time for Healthy Living. Today, Dr. Esper joins us from Terre Haute Heart-Lung Vascular Associates to talk about the treatment of advanced coronary disease. And Doctor, first off, what is TMR?
Well, TMR stands for transmyocardial revascularization. It's a new technique that was really developed in the mid-90s and FDA approved in 1998 for those patients who had no options that had failed already angioplasty and stenting. Coronary bypass surgery, which is the gold standard method, can now be applied to them. So we create now multiple channels using fiber optic bundle that creates multiple holes within the heart. You dig into the myocardium, and it creates like an amphibian heart, essentially, where they are being fed with blood rich in oxygen directly through the muscle to improve symptoms of chest pain, and those patients who are not otherwise been able to be treated for angina for any other means. Transmyocardial revascularization is done as a sole therapy by making a small incision in the chest and then treating those hearts who had been previously operated on, or it can be as an adjuvant therapy for coronary artery bypass grafting. The results are very good. There are 5 randomized trials that have been developed. The studies which indicate that angina has been relieved in better than 50% of those patients. The exercise tolerance also improves on those patients. And when combined with coronary bypass, the mortality is decreased in those patients.
And
so there is
great
some hope.
news. There is hope. How long have you been conducting this?
Well, again, in the country, there are a few centers who have been doing it for at least 10, 15 years. Here in Terre Haute, we started a program about 6 months ago, and it's available currently at Terre Haute Regional Hospital. We're trying to move on the technique to the Union Hospital. We're still working on that, but we have done about 10, 15 patients with good results on all of them.
And quickly, who benefits from this?
Patients who, again, are not candidates for any other interventions. I mean, it is clear that family members, doctors have exhausted maximized medical therapy. So patients with severe coronary artery disease who has no other options to relieve their angina and improve their exercise capacity. So those are the patients that will benefit. There are some guidelines that we followed, and those guidelines had to do with good contractility of the heart still remaining, because the ejection fraction that we calculate has to be at least better than 25%. And those patients that we studied have had myocardium that's still viable, muscle that's still alive to be able to improve some of the creation of new vessels by the multiple holes with laser.
Some valuable information, and if you have any questions for Dr. Esper, you can call 812-232-2708. Thank you so much for joining us.
Thank you very much, Susan, for inviting me.
We appreciate it. And again, our Healthy Living segment airs right here on Wednesdays. For more information, go to Healthy Living on our website at WTHI-TV.com. News 10 at midday. We'll be right back.